As thousands of members of the American Diabetes Association assemble for the 84th scientific session, this is the premier global gathering of those fighting against the deadly consequences of diabetes. And we are here to highlight the remarkable research being unveiled. Welcome back to Orlando and to day 3 of ADA TV. I'm your host, Autria Godfrey. With more than 1.2 million new cases of diabetes diagnosed each year, we are turning our focus to epidemiology today, as research and education are more important than ever.
I was diagnosed with type 1 diabetes at the age of 25. It was eye-opening to me, really, how impactful that diagnosis was to me.
Today, we highlight the outstanding educators making sure groundbreaking research is meeting the masses. Don't miss our one-on-one sit-down with this year's award winner straight ahead.
In our hospital, in the coronary care unit, over 50% of people who are admitted to the unit are people with diabetes.
And we are going global to weigh the burden of cardiovascular disease on each continent.
The condition is multifactorial in its origin, with problems at the beta cell level and also in terms of insulin resistance.
Plus, groundbreaking research coming from down under. We take you all the way to Australia to highlight a new method for treating type 2 diabetes. And it's not all work and no play. We find some time for a little fun inside the ADA exhibit hall. Remember, you can always find the latest ADA TV episode on our TVs placed throughout the convention center, on the in-house channels at several of our partner hotels, on the shuttle buses running to and from the venue, on the ADA Scientific Session website, and on our X and YouTube pages. Before we get started today, a wardrobe announcement. Don't forget to wear red tomorrow to show your support of the ADA and our mission to prevent and cure diabetes and to improve the lives of all people affected. Stop by the Shop ADA store to purchase your ADA red gear. Now, here to start us off again is Dr. Alice Cheng with a look at what's ahead on this Sunday at ADA. Hi, Dr. Cheng.
Hi, Autria. Sunday morning at 8 a.m., there will be a symposium on severe GLP-1 receptor agonist side effects in obesity treatment, fact or fiction, where they will answer the questions once and for all around pancreatitis, gallbladder disease, suicide, thyroid cancer, and how to improve the patient's experience. At 9:45 a.m., we'll hear from Dr. Mandeep Bajaj for the President Medicine and Science Address. At 1:30 p.m., among the many oral abstract and e-poster presentations, I want to highlight the Norbert Frankel Award lecture by Dr. Fidelma Dunn, who will speak on Atlantic DIP, Changing the Landscape for Better Maternal and Fetal Health. At 3:15 p.m., we'll hear from Dr. Visvanathan Moha, the recipient of the Kelly West Award of Outstanding Achievement in Epidemiology. Then at 4:30 p.m., an exciting three-way debate entitled Keeping Up with Hollywood, Who Should Be Prioritized for New Anti-Obesity Medications. At the same time, additional data from the STEP-HFpEF and STEP-HFpEF-DM trials will be presented. Yet another I wish I had a clone situation, another jam-packed day of learning.
In memory of the father of diabetes epidemiology, the Kelly West Award is given to an individual who has made significant contributions to the field of diabetes epidemiology. This year, that individual is Dr. V. Mohan, and we are honored to have him here in studio with us now. Such a pleasure to meet you this morning.
Thank you so much.
Well, congratulations on this award. What an incredible honor. Just to get started, what are your thoughts on being acknowledged by your peers in this way?
I think it's a great feeling, not just for me, because I represent an institution which I built, and therefore I keep telling my people that I get all these awards, but I'm just a courier man bringing the award to you, and it's you guys who did all the work. But apart from that, I think it's a recognition for India, because the American Diabetic Association recognizing somebody who lives in India and works in India, I think it's a great tribute to my country, and therefore I'm very happy and pleased about it.
They should be very proud. Well, let's discuss your research that was awarded. You have focused on the epidemiology of diabetes in South Asians. What can you tell us you've uncovered?
We used to refer to diabetes as a migrant Indian phenomenon, which means the diabetes prevalence is so low in India, but when they migrated to the United States, Canada, UK, Australia, anywhere, Fiji, their prevalence rates went up. So we said it's all because of the Western diet, and they put on weight, and that's what it is. But over the years, the prevalence of diabetes in India has increased so much, and in South Asia. Pakistan is even higher than India now, and Bangladesh and all the South Asian countries. So today, actually in 2015, we did a study comparing the prevalence of diabetes in India versus the Bay Area in California where Indians live. And to our surprise, we found it's actually higher in India than in California. So the clock has come full circle now, and the prevalence of diabetes in India is now higher than the migrant Indian. So it's no longer a migrant Indian phenomenon. So significant changes in the last 50 years that I've been working in this field, in the epidemiology of diabetes in South Asians.
Incredible. I want to talk about some of the specific studies. You've taken part in the CUPS, the CURES, and the ICMR India B studies. How have those evolved, and what have you discovered about insulin deficiency?
So we covered, you won't believe it, the whole country, representative population of 1.44 billion people, with a sample size of 124,000 people. Probably the world's largest and most representative study on diabetes, and probably that's one of the reasons why I got this award. So we actually evolved in stages, from part of a city to a whole city to the whole country. But of course there are many other studies, like the CARS study, which we collaborate with Emory University and institutions in Delhi, and also the PURE study, which started actually in India, but now is in 27 countries, 5 continents, and 200,000 people followed for 15 years. So it's very small, but became bigger, bigger.
Growing.
As you get your epidemiology right, then you can do really big studies, which answer a lot of unanswered questions.
And in particular, you've been able to pinpoint some of the risk factors for this population?
Yes. So you mentioned insulin deficiency. So in the West, most of type 2 diabetes is associated with obesity. And so insulin resistance is the primary driver of type 2 diabetes. What we found in South Asia is that definitely they are much, much thinner than the people with type 2 diabetes in the West, and insulin deficiency seems to be the driver and the most important factor. So that's one of the most important things we learned about South Asians, that more than insulin resistance, it's insulin deficiency, and we seem to lose beta cell function very quickly. So we've learned a lot, and the genetics seems to be somewhat different. We seem to have slightly different genes. And of course, one of the biggest drivers is the high carb diet. Right. The amount of carbohydrate we eat in the form of rice and wheat is very high.
So you've got all of this research. Your work is incredible. What do you hope that this research will continue to do when it comes to the fight against diabetes and cardiovascular disease?
So having found the causes, the obvious thing to do is to try to prevent it. And we have worked out in mathematical models, which we're now doing trials on, to show that if you just cut the carbs a little bit and replace it with protein and good quality fat as well as fiber, increase the exercise, and perhaps reduce pollution. And of course, you have to sleep well, sleep on time. There are simple things, back to the basics, basically. And if we do that, we believe that 50% of new onset type 2 diabetes can be prevented. So the next few years will be devoted to these preventive studies and to get the policy of the government also changed to encourage healthy eating, increasing physical activity. That's going to be my next move.
Well, wonderful. Well, congratulations on this award again and on all your incredible research. It's been a pleasure to speak with you today.
Thank you so much.
Research has shown that patients with diabetes fare better when cared for by an endocrinologist. But despite the growing demand for this specialized care, endocrinologists are in short supply. Take a look at how Valindo Health is working to change the economics of endocrinology to increase access to the best care for the people with diabetes.
I live with diabetes. Sometimes it can be challenging to know how much insulin to take based on what you're eating or what you're going to do.
Everybody with diabetes deals with some type of fatigue, chronic depression, strain on the mental health. It never goes away. It's really critical to see an endocrinologist.
Diabetes is overwhelming and increasing worldwide, and endocrinologists are not.
Endocrinologists create a tremendous amount of value, yet they're among the lowest paid specialists in America. And we want to reverse that.
We're aiming at integrating longitudinal care data to optimize the outcomes. We're also integrating social determinants of health data to also respond to social needs that the patient may have.
Our goal at Valendo is to improve the lives of people with diabetes by helping improve access to endocrinologists. And we want to do that by improving the way they run their businesses, the way they get paid, helping them capture more of the value they create through virtual care services and value-based care arrangements, make the lives of people with diabetes better, and make the lives of the endocrinologists who care for them better.
According to the American Diabetes Association, cardiovascular disease is the leading cause of death globally for people with diabetes. However, 2/3 of adults in surveyed countries don't recognize diabetes as a major cardiovascular disease risk factor. Well, today, ADA TV goes global as we try to understand just how big of a problem diabetes is around the world.
I'm Mohammed Hassanain, Professor of Medicine in Mohammed bin Rashid University and Consultant Endocrinologist in Dubai Health.
I'm Dr. Rakesh Sahai. I'm Professor of Endocrinology at Usmania Medical College in Hyderabad, in India.
I'm Kamish Kunti, Professor of Primary Care Diabetes and Vascular Medicine at the University of Leicester, UK.
Diabetes in UAE and in the Gulf region in general is a very big problem. On average, there is a prevalence of diabetes of 15 to 20% and about a similar number of pre-diabetes. So all in all, about 1/3 of the population have either diabetes or about to get it.
We recently had the results from the INDIAB study, that's the India Diabetes Study, and we realized that we have 101 million people with diabetes, 135 million people with pre-diabetes.
In the UK, diabetes is a major problem just like any other country. I think the prevalence is about 6 to 8% depending on what populations you look at the adult population, but more so in more deprived and ethnic minority population, which is a major issue for us in the UK.
Many people are knowledgeable about the symptoms of diabetes because they have a family relative or a friend with the condition. However, many are undiagnosed with it because in the earlier stages it's asymptomatic.
Half of the people are unaware about their problem, and that is the major issue that we need to increase the awareness amongst the population, try to see that they get to know about diabetes early and control it well so that they can prevent the complications.
In the UK, it's very variable. The major issue is in the social determinants, so those people who are deprived and people from ethnic minorities, the knowledge base is much lower.
Diabetes is a very common cause for cardiovascular disease. One of the studies we've conducted in our hospital in the coronary care unit, over 50% of people who are admitted to the unit are people with diabetes.
If you look at the cardiovascular disease burden in India, we say that it is 20 times higher than the non-diabetic population.
In the UK, the estimates from Diabetes UK, which is our major charity, are that in people with diabetes there are about 600 heart attacks per week and about 770 strokes per week.
There's a lot of barriers for the care of people with diabetes, specifically those with cardiovascular disease. Understanding why should they take a drug to lower lipids or blood pressure when they have no symptoms.
Now, globally, people with diabetes are living longer and they're developing multiple long-term conditions or multimorbidity. And coordination of care is quite fragmented. And seeing them at 5 different clinics is a major problem. And that's why sometimes what we feel is that they're not being managed as adequately as they should be.
I think what needs to be done is not just looking at one aspect, but looking at a life course approach. Addressing all these issues right from early in life is going to make a difference in terms of bringing down the risk of cardiovascular disease.
I think there needs to be global public health issues. Public health interventions certainly do help in countries. We know sugar taxes help in certain countries.
Raising the awareness of healthcare professionals as well as people with diabetes about the importance of this topic. The conferences such as the ADA and other regional conferences are a very good tool to make people understand this issue.
The current standard treatments for type 1 diabetes are primarily insulin administration by injection or an insulin pump. Well, despite insulin's life-saving role, the therapy itself is potentially dangerous if too much or too little is administered. This is why St. Vincent's Institute of Medical Research is committed to investigating other forms of treatment.
To carry out a study like BANDIT, you need a big team to make that work, and we're very lucky not just to have a funding agency like JDRF and a provider of the medication like Eli Lilly, but really want to emphasise the fantastic teams around the country who work in type 1 diabetes.
ADDIC is currently collaborating widely with colleagues from the US and Europe and the UK, but we want to do more in partnership with other organisations. And we are very keen to join other organisations to run the key prevention trials that will turn this disease around.
We're on the cusp of these therapies which change the progress of type 1 diabetes, that allow the body's insulin production to remain, that after many years of studying these things, these are now going to move into clinical practice. We're not there yet, but that it's a realistic dream.
The ADA exhibit hall is officially open for business. Let's take a quick tour to see what all the hall has to offer this year. Turning now to our Debate in Diabetes segment. When it comes to type 1 diabetes progression, what's to blame? Beta cells or immune cells? Here to debate both sides are Dr. Edward Phelps and Dr. Jamie Felton. Our thanks to you both today. All right, Dr. Felton, I want to get started with you because you argue that immune cells are doing the most damage. How so?
Yes, so I think the first indication that we have that anything is going on in type 1 diabetes are the presence of autoantibodies, which is indicative of an autoimmune response. So that's the earliest thing that we see. As disease progresses, we know that the immune response is required to continue to drive that beta cell destruction. There are many people who may stay in the early stages of type 1 diabetes that don't progress, and often that is because the autoimmune response is not active. I think we've seen that in animal models and also in models of therapy.
Dr. Phelps, this is a very hot topic, hotly debated. You argue that beta cells actually do have a significant role in type 1 diabetes progression.
Yeah, I think there's quite a lot of clinical evidence that at onset, at diagnosis, there's a significant remaining beta cell mass, but there's very little insulin secretion in response to glucose. But there is a remaining response to other secretagogues. So that's very suggestive that the beta cells that are there are dysfunctional. So I think if we're talking about progression from stage 1 to stage 3, beta cells have a critical role to play.
And is this a new idea or a new concept, the role that beta cells might play?
Well, you can go back in the literature and you can find papers all the way to the early 80s talking about beta cell death. Is it suicide or homicide? Okay, so, I think this is not a brand new idea, but there's a lot of new evidence coming out in recent years.
And do you feel like physicians are taking a closer look at beta cells?
Yeah, I think that's really important because if you're going to treat someone with type 1 diabetes at diagnosis and get them back off insulin or insulin independent, you can't just stop the immune system, you have to reactivate the remaining beta cells.
And recent studies have indicated there's actually interplay between beta cells and immune cells when it comes to contributing to diabetes. Can we make the argument that they're both to blame?
I think we can, but this wouldn't be a good debate.
We're not here to agree.
I have lots of respect for Dr. Phelps, my opponent, and I do think in all of the things that we debate, there is interplay, and there are important considerations to be mindful of, especially when we're thinking about therapy. However, I will maintain that the primary driver is the immune system.
Dr. Phelps, though, would you argue that only treating immune cells, would that be a successful path forward in the fight against diabetes?
I think that's a really interesting question because many people would say no because we have not been able to do that. At the same time, we probably are not treating the immune system at the right time point in order to be able to do that. So I do think there's potential. Maybe not at the time points we're treating it now, but I do think there's potential.
Dr. Phelps, would you be one of those people that would say no?
Well, again, I have a lot of respect for my opponent.
I love how cordial we are here.
And her position. But I think if you only treat the immune system, that won't be as sufficient.
All right. Do you feel, though, that by acknowledging the role and then subsequently treating beta cells, the role that they play in type 1 diabetes, that we could actually start to see some real progress?
Well, I take issue with the point that start to see real progress, because I think we actually are seeing real progress on many fronts. And if you just attend the sessions at this meeting, you see beta cell replacement, you see immune therapies, which are starting to have progress for patients, clinically. But in terms of actually reversing type 1 diabetes, then I think, you have to deal with the beta cells.
Final thoughts to you both when it comes to the path forward on either stopping the progression of type 1 diabetes or reversing it. What's the best path forward?
My bottom line is that type 1 diabetes is an immune problem that leads to an endocrine defect, and so we need to address the immune system.
My bottom line is that the beta cells are a significant contributor to type 1 diabetes, and if you don't find a way to stop their dysfunction, you won't be able to reverse the disease.
Thank you both for your thoughts and for possibly the most cordial debate we've had to date. Thank you both. Appreciate your time. Now to Krea Therapeutics, a gene therapy company focusing on a one-time gene therapy treatment for type 1 diabetes, aiming to replace the current regimen of multiple daily insulin injections. This innovative therapy has the potential to significantly improve blood glucose control in patients with diabetes.
Krea is a fully integrated gene therapy company that is focused on bringing one-time treatments to diseases that affect millions of patients around the world. Gene therapy is one of the most transformational new therapeutic modalities emerging across a number of different areas of medicine, using DNA delivery to drive endogenous protein expression. We're looking to take the next step in clinical care of patients with diabetes that could drive multiple years of therapeutic benefit for patients and really drive improved glycemic control and reduced patient burden. Ultimately with the goal of making gene therapies that are affordable and accessible to patients worldwide. We think we are the company that has the right technology platform, the right team, and the infrastructure and capabilities to deliver gene therapies at scale to millions of people around the world. And I think that will be Krea's contribution to medicine, to make such an exciting technology a part of mainstream medicine that's taught to clinicians around the world.
All this week, the ADA continues to honor academics, healthcare professionals, including diabetes care and education specialists who have contributed substantial advances in the field of diabetes care and research. Here now in studio is this year's Outstanding Educator Award winner, Dr. Joshua Neumiller. Thanks so much for your time today.
Thanks for having me.
Absolutely. First off, congratulations on receiving this award. What an incredible honor. How does it feel to be recognized by your peers?
Well, it's amazing, and I'm still coming to terms with it. It seems unbelievable as a long-term attendee of the ADA scientific sessions. It's been amazing, and I think this is really particularly impactful for me because my mentor that really introduced me to the ADA was the Outstanding Educator in 1989. So to do this 35 years later, I think really speaks to his impact and legacy.
You've followed in some incredible footsteps.
Yes, absolutely.
Now, you have a personal connection with type 1 diabetes. What can you share?
Yeah, so I was diagnosed with type 1 diabetes at the age of 25. I was already a practicing pharmacist, and it was eye-opening to me really how impactful that diagnosis was to me and how overwhelming it was even as a healthcare professional having to start insulin. And so at that point in time, I didn't really know. I was early in my career what I wanted to do, and it really opened my eyes to really the huge need there is for diabetes education to help people living with diabetes.
I was going to ask, is there a mental shift that happens when the physician becomes the patient?
I think so, yeah. It's just having that personal experience, it really just opened my eyes to the vast need there is.
So you've been recognized for your outstanding educational efforts. Can you share a little bit about your path with us?
Yeah, there's a couple areas I've really tried to engage in. One certainly is working with people living with diabetes and their care partners. And I've been fortunate to be able to work in the home care setting where I can actually go into people's homes and work with them in their own environment and really meet them where they are. And certainly my work with the ADA has been impactful as well, where I've been able to work on consumer-facing educational materials as well as working on educational programs for the larger multidisciplinary care team.
You mentioned your work with the ADA. You've held a number of positions within the ADA over the years. Any one in particular that has really stood out to you as far as being able to have the most impact?
Yeah, the one that really stands out to me is being on the ADA's Professional Practice Committee. That's the committee that updates the standards of care in diabetes each year, which is really worldwide, one of the most widely utilized diabetes guidelines. And so to be on that committee and serve as chair for a couple of years was really an amazing experience. And there have been some downstream benefits to that as well, working with collaboration with other organizations to work on professional guidance to really impact the care of people with diabetes.
So what's next for you? You have a big year coming up next year.
Yeah, I'm very excited. I joined the ADA Board of Directors this year as the President-elect for Healthcare and Education, and I'm really excited to really engage with some of the important initiatives ADA is bringing forth, like their Institute of Learning. We learned yesterday from our CEO about the Obesity Association, so that really opens a lot of important avenues, and so I'm really excited for the next couple of years.
Yeah, very exciting new initiative.
Yeah,
well, we look forward to sitting down with you this time next year in Chicago to hear how the year is going as President of Healthcare and Education.
Awesome.
Again, congratulations on your award.
Thank you so much.
Over the past 100 years, no drugs have been developed that address type 2 diabetes as a progressive inflammation disorder. Well, from Sydney, Australia, Myopharm Limited is changing that with the creation of Triglitza.
Type 2 diabetes is a global problem. In the US, there's 30 million patients with type 2 diabetes. Most know they have it, but there are a lot of people who don't know they have it. And then there's another 30 or 40 million patients, likely due to obesity as well as genetics, that will get type 2 diabetes in the future. These are pre-diabetics. So unfortunately, those of us taking care of patients with diabetes will never be unemployed because there'll be plenty of more patients coming in the world with type 2 diabetes, not only in the US, but it's a worldwide problem.
Over the past 100 years, no drugs have been developed that address type 2 diabetes as a progressive inflammation disorder. Our early research indicates that the anti-inflammatory effect could redefine this product, Triglitza, as a first-line therapy, or be given as an adjunct therapy. Due to the high amount of treatment failures endocrinologists and general practitioners are experiencing, we believe that Triglitza has the potential to be a game changer in this large unmet clinical need.
While you are here, there is so much to see here on site. Make sure to stop by the ADA Shop Diabetes bookstore, where you can stock up on the latest professional publications and resources and show your support with ADA gear. And don't miss the membership lounge. You can relax, have a snack, and charge your device while ADA staff answer any questions you may have about membership renewal or benefits. And in the newly opened exhibit hall, the ADA booth is a must-see while you're here this week. It's been a thrilling third day here in Orlando, and we hope you've enjoyed learning about all the remarkable research being conducted and hearing from the outstanding educator committed to the dissemination of this knowledge. Remember, you can always find the latest ADA TV episode on our TVs placed throughout the convention center, on the in-house channels at several of our partner hotels, on the shuttle buses running to and from the venue, on the ADA Scientific Session website, and on our X and YouTube pages. We've still got one more full day of diabetes coverage right here for you tomorrow. So until then, go have a great one.